Let's do this, Bridge.
Cheers.
Game time.
Sláinte.
Sláinte. Hello, welcome back to The Bleeding Truth. My name is Sally McNally. I'm the Irish midwife.
And I'm Brigid, Sally's daughter.
This podcast is about women's health and my own personal stories as a midwife.
So please like and subscribe, and don't forget to hit that notification bell so you don't miss any of our future episodes. Thank you guys so much for supporting us this far already. And also, before we get into today's stories, just want to say listener discretion is advised because some of the topics that we touch upon are for mature audiences only.
Yes.
And yeah, one last reminder is that if you didn't know already, Sally does Q&As in every episode. So if you have any questions for a midwife, feel free to drop us that in the forum that it will be linked below, and we'll answer in one of the future episodes.
Great.
So today's question is actually from one of my peers who is pregnant. And she wanted me to pass on the question to you. So it's kind of a little bit of a setup, so I'll explain her situation. So she's pregnant. I think she's in her second trimester right now. But during her first trimester, she actually ended up getting COVID, which she, was worried about, of course. But in that situation, she ended up going to a couple different doctors to get their opinion on, the situation. And she had different recommendations from those doctors. One of them said you're totally fine. A different one said you need to get induced a week early, once you go have your baby, which means something's wrong in some sense.
Yes.
And so she's kind of been getting different opinions, and she doesn't really know if that's the right thing to do or why, because she's having a normal pregnancy so far. So she's not sure if that's the right recommendations that she should be listening to, or what it even means to be induced early into child labor. So she wanted to get your opinion on that situation.
Well, first of all, I'm really happy that you know what a second trimester is. That's so great.
I barely do.
But it's wonderful that you're thinking about stuff like this and talking about stuff like this with your friends. And first of all, congratulations to your friend on her pregnancy.
Yeah.
How wonderful is that? We come across women who get infected with COVID all the time. And I'm happy to report that most of their babies are fine. And if you get infected with COVID in your first trimester, I don't see any reason why that would lead
Right.
you to be induced a week early. I'm thinking that perhaps her obstetrician or her midwife may have found something other than that. Perhaps she's a newly diagnosed diabetic. Perhaps she has hypertension. There may be something else that we don't see to complete the whole picture of her pregnancy. But just being infected by COVID early in the pregnancy, if she's cured and now she's fine, I don't see any reason why she would be induced.
As far as I know, she's fully healthy and doesn't have any health risks like that.
Yeah.
So, in that case, do you think there's a lot of differing approaches from midwives, like in different locations, just here in, say, California?
With regards to COVID, where I am, I think we're all pretty much doing the same thing. We're trying to advise women, not to get COVID if possible. We pretty much across the board advise them to get the vaccinations, that it seems to protect the baby a little bit too. What we worry about when a woman gets COVID in pregnancy is that she can go into premature labor, that the fevers affect the body in such a way that she starts to contract, and then the little baby may end up in the NICU. And to end up in the neonatal intensive care unit, is not the way anybody wants to start your life. But NICU people, nurses and doctors in there are actually some of my favorite people in the world. I think they're angels. I love NICU nurses. They come, they're quiet in the back of the room, and they save babies, just so kind, so gentle. But that's a different story. But I have, been with women who are in labor while they're infected with COVID. And
Right.
most of them, I'm happy to say, do just fine. We try to control their fevers with Tylenol. We check the baby. We continue to keep them together if possible. If the baby's not sick, then they stay together. And mom will have developed antibodies in her own bloodstream that she can then pass to the baby,
Gotcha. Yeah. Yeah.
um, with breastfeeding. Yeah. And I've met some women, who um, I remember one woman just pretty recently, last year, during the height of the, COVID numbers. She was streaming COVID. She was sick. Her
Mm.
husband was sick. The two of them were sick. And we were trying to deliver her. She was in labor. She had her mask down here around her chin. And I kept on saying, please, can you put your mask up? And
Oh.
she was, she was, it was hard, you're sick and you're in labor. Um, but her answer to me was, but sure, I have it anyway. You know, that's what she'd say. I have it anyway. What's the point in putting my mask up? I didn't answer her, but in my heart, I was like, that's really sad. She didn't care that she could infect everybody
Mm.
else who were trying to help her now in labor.
Yeah.
But most women, they're going to come in, they're going to be negative on a COVID test, even though they may have had COVID.
Mm.
But they're going to be carrying the antibodies. And so many women we see have that story. Yes, I had COVID last year, or, at the
Mm-hmm.
beginning of my pregnancy. So I
Yeah.
hope your friend is not feeling anxious and worried and thinking, something must be wrong. I'm sure that they're doing a good job of monitoring her baby and
Mm-hmm.
checking the fluid levels. And
Yeah.
if she's not sick right now, she should just stop worrying and
Yeah. Yeah.
and,
I
and
I
check whoever said you should be induced at 39 weeks. Perhaps there was a secondary reason for that.
Right. Yeah, I'll definitely pass that on to her. But I think that's really fascinating that you've had to, you know, learn as you go, what are the risks of
Hmm.
women in childbirth having COVID and such. But at
Hmm.
least if it's, that early on, you don't have to worry about it so
Yeah,
much. Yeah.
we've relaxed a little bit. We're not as worried now.
Yeah.
We test the women when they come in to see if they're positive, and if they're not positive, of course, we're taking their masks off so that they could be more comfortable in
Oh
labor.
yeah. Yeah, I feel like that must be so hard.
Awful,
Yeah.
awful. Yeah,
It was like sweaty and stuffy and
yeah.
oh.
Did I forget to put makeup on one eye? Sometimes I do that. I look in the mirror and I only put
I
mascara on one eye.
don't. Did you?
It didn't look like that.
Okay. I was wondering if you've been following everything that's been going on in the news with Roe versus Wade.
Yeah, I've been listening, and it's kind of scary times that we're in. Of course, Roe versus Wade is very pertinent to the kind of work that I do. Um, I am a midwife, so of course, my work is with the pregnant women, trying to, bring them to term. And so I don't work directly doing abortions in any way. But of course, some of my colleagues, I know a lot of midwives who work in Planned Parenthood and who provide abortion in their, practices. So it's a difficult conversation for any of us to have.
Mhm.
'Especially now for me, I'm an Irish midwife, brought up by the nuns in Ireland, and for us, we didn't have abortion as an option in Ireland when I was a young
Right.
woman. It was against the law. And if a young girl wanted to have an abortion, she had to take the boat over to England where she could have one.
Oh wow.
Hmm. And, you know, it's only legal in Ireland just recently, within like the last 10
Right,
years.
right. I
Hmm.
remember there was a huge like celebration about it or something.
Yeah, they kind of like brought abortion and divorce into Ireland at this around the same time.
Really?
um,
Oh, it's funny.
but it's honestly, it's not really a laughing matter. It's a
Right.
very serious discussion. And I always feel very conflicted with this because, as a very young pupil midwife, as a student midwife, I remember one of our jobs, we had to go out with the public health midwife to visit the women in the community, women who were pregnant. Sometimes we'd come with breastfeeding support to the postpartum ladies. Um, and we do postpartum checkups in their home, which was so fun. I loved it. But I went with this midwife one day to visit a 15-year-old who was living in a kind of like a an old broken down house that wasn't like had no running water or plumbing or like anything in it. It was all broken down. She'd been thrown out of her house because she got pregnant and had her baby. And her boyfriend had gotten thrown out of his house. So I remember coming into this broken down house. There was broken glass and the door had no lock. And they were sitting on the floor with this filthy blanket and a filthy baby. And the two of them were smiling and talking to the baby. And there was rats running by the door, in and out by the door. And I was like horrified to see this scene. I was like, oh my God, they've got to like help them, take the baby off them, bring the baby to, somewhere. And the midwife was very religious and she was telling the girl what a good girl she was and what a great job she was doing. And I was like, what? This is craziness. And then on the way back to the hospital, I was like, they need help, right? They need social services. They need, to be taken into a home. And she was like, oh, yes. And we'll try to help them as much as we can. But aren't they great? They saved their baby. They didn't take the boat to England. And now they have this beautiful baby. And I often wondered what happened to that baby. The baby looked, fat and healthy, and I believe she was breastfeeding. So I hope everything worked out, but it was a very hard start.
Right.
But that was one that always stuck in my mind. And I remember also, hearing every now and then of like very young girls that would die, hiding their pregnancy or having their babies on their own. And one uh, really struck a chord in Ireland in the 80s. She was only 15 again, and she went into labor. Nobody knew she was pregnant,
Mm.
and she went to a grotto where of the Virgin Mary, and went in there and died at the grotto, or bled almost to death. And when they found her, she died on the way to the hospital. But
Oh, wow.
herself and her baby died there, at the grotto, um, and that doesn't seem right either, right? That she couldn't like talk about it, she couldn't get the right help that she needed. And then I've come across so many situations where the girls couldn't tell their mother, I'm pregnant, and all of a sudden she goes into labor, and then they're all in the hospital, and the parents are like completely shocked. I've seen that a few times. I've delivered a couple of 11-year-olds, and
Wow.
then 12, 13, but 11-year-olds. And one 11-year-old I can remember, she was in the hospital in Ireland, very sick. She had pregnancy induced hypertension, or preeclampsia is another name for it, that developed into eclampsia, which is seizures.
Oh, wow.
And she was so sick. She was so swollen. Her whole little body was bloated. She was having seizures. She was so sick. Um,
An
and
11-year-old. That's a
an
child.
11-year-old, yeah. Yeah. And I believe the baby lived. I believe that they got a live baby and she lived. But it was like so horrific. And then nobody would ever talk about who the father of the baby was. But we, as young midwives, we were speculating, that the that it must have been a relative.
Wow.
That's what
That's
we got, that
horrible.
feeling that it was a relative. But yeah, it was horrific, and
Is that
what would
in that
happen
case?
here?
Well, in
Yeah.
that case, like, is there anything you could do social services wise, or does the baby
Oh
go home
yeah.
with them?
Well, yeah. I believe the baby went home with her, and of course,
Oh.
social
I feel
services
like
always involved in something like that.
okay, because I feel I was gonna say I was like, there's no ways
Yeah,
nothing would happen if an 11-year-old came in. Like,
yeah. And the police as well.
yeah,
Yeah,
holy
yeah.
smokes.
Right. Yeah. But that was the youngest. But I, of course, in Saudi Arabia, I saw some really young girls, young brides coming in having their babies.
That's so sad.
Yeah. So it's certain cases stick in my mind. Like I remember a lady who had cancer of the spine,
Oh wow.
and this was in Ireland before abortion again. And I mean, she could have taken the boat over to England and had an abortion, but she wouldn't. Um, and she was dying, and she wouldn't even take pain medication because she thought it
Wow.
would affect her baby. And I remember she was like fully pregnant, and we used to hear her moaning in pain, not in labor, but in pain from the cancer of her spine.
Oh
And
wow.
she had her baby and died like really soon afterwards. So I have these memories, of like, really difficult situations.
Right. But like, do you think that some of those would have been better off had they
Well,
done something?
for the
Yeah.
woman herself, I mean, her life could have gone on normally, but
Maybe not
perhaps.
the cancer one, but
Mhm.
yeah.
Yeah, right. Well, the cancer one, perhaps she could have had a certain type of surgery or treatment, radiation, chemotherapy. She may have lived, but I mean, that's like a really a huge
Yeah.
example of giving your life for your child, right? And
Right.
who are we to judge that she was wrong either,
No, yeah.
But then I've met women like the woman that stays in my mind from here where I live. She was a prostitute in labor. She came somehow to Ventura from LA, and obviously, had a lot of diseases and was really ill, heroin addict. Um, and we were trying to find her story, and then we realized, well, she's not from this area, so nobody has seen her here. She had no doctor in the area, so she gave some address in LA. So we called the hospitals in that area, and we found somebody who knew her, and they were like, do not let her take that baby home. One of her babies died. It's under suspicious circumstances, and all the other babies were in foster care. Right?
Oh
Do
wow.
not. That was the warning that the nurses were giving us. Do not let her take that baby home. She's high risk, and she's HIV positive and other things too. So the poor lady, she had her baby, and she was obviously mentally ill. Also, she had psychosis. She had the baby, and I remember we put the baby on her, and we covered them up, and we were like, we better stay in the room, she's high risk, we gotta like stay with them. And then she covered herself up with the blankets, and we could hear this kind of like licking sound, and we pulled back the blanket, and she was licking her baby. She was licking her
Oh wow.
baby. Yeah, yeah, it was really sad. So we tried to like help her, and we tried to clean the baby and stuff, and she just kept on licking the baby. So we got her a bottle to give the baby. She didn't want to breastfeed, and we were like, we don't think she should breastfeed. We were like in the room, and we were like, what's going on? Again, the blanket was over her head, and we said, well, we have to keep an eye on her. We pulled back the blanket, and she's drinking the baby's bottle. She was drinking it all down.
Uh-oh.
So we met women like that you think, wow, how could she be a mom,
Mm-hmm.
But the sad thing is she loved her baby. Like, of course we had to take the baby and bring the baby to social services, and her
Oh wow.
her relatives were going to come and take the baby. But the last I saw of that woman, she was standing looking in the nursery window. At that time, we had a nursery where the babies would be in there. And she was standing looking in with her little jeans on and her you bleed a little bit after having a baby, and the blood was coming through onto her jeans, and she was just standing there with her hands on the window gazing in at her baby. She loved her baby, and it would have been so nice that if we had the right way to look after these people, that they could be together, but it was impossible. And that was the last I saw of her,
Yeah.
because she left the hospital and went off into her wildlife, gone again.
Wow.
So there's a lot of women, I see, not a lot, but every now and then we come across a woman delivered the baby and she doesn't want to look at the baby. There's no, she has no feeling. She doesn't want to look at the baby. She doesn't want to touch the baby. That there's no bonding, and sometimes the bonding comes slowly over a few hours. Um, but sometimes we don't know. Sometimes that baby goes home with a mom that doesn't bond, and sometimes
Wow.
we see situations, Bridget, where we can't tell. You know, is that a baby born due to a rape, or was she being abused by the father of the baby in some way where she's not happy about the pregnancy?
Mm.
Um, and
Yeah, I'm
and
sure you see like all of the worst possible
yeah,
things.
yeah.
Yeah.
So, and all of those are the reasons that people use to support abortion. That
Yeah.
say, perhaps, these women, and they're like the wilder outside reasons. And then the other reasons are she's really young, or she's not ready, or
Yeah.
it's a surprise, or she has like already 6 children, and there's so, or she's sick, or the mom is sick, and that to have a baby like that lady with the cancer, she could have, made the decision not to have the baby, and she could have lived for her other children.
Right.
So it's a really, really tough thing to talk about or even to think about.
Right. Or to decide whose decision it is.
Exactly.
Yeah.
It should, come down to the woman herself. Like, on the other hand, I come across women who are trying to get pregnant, um, women who need surrogates uh,
Mm.
to have their babies, or women who I come and I have to tell them, your early pregnancy didn't make it.
Oh
People don't
wow.
understand how often that happens. Maybe 10% of the early pregnancies don't make it. Sometimes women don't even know that they were pregnant.
Oh wow.
But then the women who are like watching their ovulation and watching to see if the period comes, and then, oh my gosh, I'm pregnant, I'm pregnant. And some women have um, recurrent abortions, recurrent spontaneous abortions, where
Mm.
they were pregnant yesterday and now, for some reason, sometimes it's a genetic reason, or we don't know why, those early pregnancies, suddenly they're not pregnant.
Yeah.
And when I see the sadness and feel the sadness in them, it's so sad that, that they couldn't get a baby from someone who didn't want their baby. If only things were even and fair.
Yeah.
Um, it seems so sad with those ladies who lose their babies. And when I see the sadness and feel it, I always tell them, write a little letter to that baby. Tell that baby what they meant to them. You know,
Oh.
Tell the baby the name that you would have given them. Tell the baby the things that you had planned for them, or the excitement you felt when you saw the positive pregnancy test. That they have to grieve. They have to grieve in some way. And I tell them to leave that letter, on running water, so that it runs, not like to let the baby go, but to make space, in their heart for maybe
Mm.
the next baby.
Yeah.
But I've also come across like situations like babies, that would be born who are incompatible with life, that cannot live.
Right.
Before abortion, we would have had a lot more babies born with severe abnormalities that they couldn't live with. And I've
Right.
seen plenty of that. Um, but in Ireland, we were taught that if the baby was born alive with an incompatible situation, they would hold the baby until they died. Like somebody would be assigned to stay with that baby and hold the baby if the mother wasn't able or, didn't
Wow.
want to, that a midwife would stay with that baby until they died.
Wow. Is that only in Ireland?
Well, I'm sure it's not only in Ireland.
Yeah.
Um, but I remember a few situations, where there's different things like an anencephalicus, where the top of the brain wouldn't have formed, where it's kind of like open
Oh,
and not
wow.
forming, but the baby might be born alive.
Yeah.
And sometimes that would take hours for the baby to die, but we would hold those babies until they died. As a, that there's life, there's
Wow.
little spirit in there somewhere. And out of respect to the baby and the family and life itself, Um, so it's a very difficult thing. And now, like these babies, perhaps parts of their little body could be donated to other babies,
Oh,
you
wow.
know? Um, so there's,
I didn't even really think about like the donation side of, I
yeah,
guess that does happen.
yeah.
Wow.
But I mean, I've seen babies born with severe abnormalities like conjoined twins in Saudi
Hmm.
Arabia. Or
Oh,
I
wow.
remember one baby born with no eyes, but no eye sockets, like completely closed off. And it
Whoa.
felt like, whoa, like a trap, like a horrible situation that the baby was trapped inside their own head. That's how I felt when I looked. And I'm sure if that was like seen on an ultrasound, or that genetic problem
Hmm.
was picked up in an early genetic screening here, the mom would have been given the option of aborting that baby, because there was other abnormalities too.
Wow.
Um, but maybe that person is alive and maybe they're living a good life. You know,
Right.
who's to know? What.
Wow.
Um, but some abnormalities they're incompatible or really difficult. Like
Yeah.
some babies can be born, sometimes we come across a situation. Here's another situation where a woman might go into premature labor. Her membranes might rupture like really early, and she might go into premature labor. Some women, they want that baby, they don't want anybody to disturb it, they want to keep it in as long as they can, every minute that they can, to try and give their baby a chance at life. And some women will say, well, it's obvious my baby would have severe problems, so it's okay to let me labor, don't try to stop it. So, and then there's like, at what stage do the
Wow.
doctors decide to do that?
Yeah. Yeah.
So, like, I remember when we used to save the babies at 24 weeks, and that was like, wow, you can save a baby that's 24, 25 weeks. Now it's down to 22 weeks. But the
Wow.
younger they are, of course, I think it's like 1 in 10 babies
22.
who
Isn't
are,
that like half? Or no, no, no. Where's
it's just a
22?
tiny bit over half, but
Wow.
it's like really hard for the NICU people to be able to save those babies. Like I think it's like 1 in 10 that might actually go home. I
Right.
I don't know the
And then
statistics.
do you know anything about how that child or person will compare to its peers, say like as they
That's the
grow up?
thing. It depends on how well they did during their time in the NICU. And
Mhm.
they spend months and months in there.
Yeah.
And of course, it ends up with being really high bills,
Mhm.
high
But I
insurance
mean just
bills. And
like, you know, I'm sure it's not the same as being in the womb as they should be, right? They're
no,
probably
yeah.
still going to lack some of the developmental. I don't know. I'm not an expert, but
Well, that's
yeah.
something that you'd have to follow them, you know.
Yeah. That
Um,
would be a really good study. I wonder if
oh, I'm
there's some
sure
out
there's
there.
lots. There's
Maybe
lots.
maybe
Yeah,
we could look
lots of
into
studies.
that. But
But
wow.
maybe we should have a NICU person come and talk to us about that.
That would be really interesting.
Yeah, let's do
Yeah.
all of that. But
Yeah.
these
Find us
babies, their
one.
little skin is see-through, that sometimes they're wrapped like in a kind of a plastic, and they're put into like a situation that's like they try to recreate the womb,
Oh,
the
okay.
uterus.
Wow.
They
Yeah.
try to recreate that, and they're such geniuses,
Wow.
how they save these children. Yeah.
That's crazy.
And for the women who want those babies so badly, of course, everybody wants to do the best they can for the children.
Yeah.
I can remember one lady, she had a twin pregnancy, and she lost the first twin. And the second twin's membranes were bulging out through the cervix. So we put her on an incline like this with her head down for like a week. She was like this in the bed to keep the membranes in,
Wow.
to get her past the 23 weeks or whatever it was, so that then she could have that baby and
Wow.
it had a chance of survival. And she
Wow.
would have willingly stayed like that for a year. She loved her baby so much. She would have willingly, yeah,
Yeah.
yes,
That's
little
wild.
baby
Yeah.
Liam.
Oh.
But like contraception comes to our conversation a little bit too. Like, if they take away a woman's right to choose whether to have an abortion or not, will the right to contraception disappear as well?
Yeah.
Oh.
I doubt it. I think it's like kind of a fear. People get really extreme and they think they're gonna take away all of our rights. Um,
This is so
but
serious.
still, yeah,
Yeah.
it is such like just even the topic is something that I think is
But
worth
I have a
talking
funny
about.
story
Uh-oh.
when I think of contraception.
I have a recent funny
Have
story, but
you?
I won't share that.
Oh, I
You
want
tell
to
me
hear
yours.
it.
You don't want to hear it.
I do. Mine is at home in Ireland. My mother was such a darling woman. But she didn't know a whole lot about contraception or anything like that. But this day, my father was all upset because the drain from the house, the sewer drain, was blocked. So he
Uh-oh.
had to go down, and he always was a do-it-yourselfer, right? He had to go down with this thing called a snake, like a big thing to push it on and clear it out, right? So he was able to clear it out, but when he pulled back his snake thing, his drain thing, there was a condom on the end of it. So there was a condom that had got stuck in our drain. Now, the house had 6 teenage daughters at the time, right?
And no boys.
And no boys. So my father marched us all out into the garden. And my mother was like, "What's going on? What's going on?" And he stood there with the condom in his hand like this. And he said, "Who owns this? Who does this belong to?" And he's holding the condom and it's like shaking in his hand.
Oh,
Oh, the
gross.
condom.
Ew.
And we're all like looking shocked at this scene, right? And my mother looks at it and she says, "What is it, Pat? What is that?" And she said, he said to her, "Never mind, Kathleen. Now, come on, girls, tell me, which one of you own this?" And she's like still saying, "But what is it, Pat?" And one of my sisters said, "It's a condom." And then somebody else said, "Maybe it's Maria from next door." Maybe it belongs to. But no, but I don't think anybody ever admitted to
No one
who owned the
admitted to it.
condom. And how could it be coming from this house with 6 girls?
That's so funny.
But my mother didn't know what a condom was. Yeah, but she had 6 children.
Yeah. It was a different
But I'm
time.
glad she
Yeah.
didn't find out, because I was the last of the 6 children. Maybe if she'd found out what they were, I wouldn't be here.
Oh, that's so funny.
Now your funny story.
I don't know if you want me to share my funny story. I'll start it.
Okay.
So, about 2 or 3 weeks ago, I was home at your house.
Okay, don't go on.
Okay. I told you didn't want me to share it. Okay.
My God.
So yeah, we'll move on.
All right.
Ask us in the question form if you really want to hear that story. Yeah, no, I think jokes aside,
Mm.
it's a very important topic that I'm glad like we get to
Wow.
talk about.
It's hard to talk about, isn't it?
Yeah.
It's hard to talk about because you're like nervous to let everyone know what your thoughts on the subject are, because you might lose friends, you might, you know, insult people, or it's a really tough one.
Yeah. Plus, I mean, I understand your situation. It's professional. You have to deal with all the
Yeah,
cases. So, um, not sharing your exact opinion is understandable. I feel like personally, I'm pretty clear on my stance on it
yeah,
because um I guess I think about what I would want if I had different
hmm,
circumstances. You know, if
yeah,
I was to find out I'm pregnant right now, there'd be no way I'd abort it because
yeah,
I would love that, but also I know I'm lucky enough that I can support someone if I'd have to. You know, I have the support system in my life to help me figure it out, if that was the case. But I think if I had other situations, having an option to save my own life or to have a kid at a time where I was or am more stable could make a huge difference in that kid's experience,
right,
you know?
yeah,
So I definitely, I guess that's kind of where my stance is personally, just
yeah,
where, you, depending on your life circumstance, it could have a huge impact on that kid's life. So it
yeah,
should come down to the mom's decision, at least
yeah.
in my eyes. But
I think that we need to, you know, keep options open for women. We
mhm.
need to not judge women. We need to support women. We need to
Yeah.
lift each other up, and not tear each other down. And we need to educate young women,
Yeah.
especially children. Education is key to this.
Yeah.
Yeah, to start early education in the schools, not to like keep it all secret until it's too late, and then all of a sudden she's like 15, pregnant with no options,
Hmm.
you know. You
I
know
wonder
what's really interesting,
what.
Bridget, right now? I keep coming across these young women who are studying their own fertility,
Mm.
and that's how they don't get pregnant. And I
Yeah.
think that's so interesting nowadays that, I mean, there's all forms of contraception, and there's wonderful ones, brilliant ones. I think it's amazing, all the options that we have now. But then there's studying your own fertility. And if women have a lovely regular cycle, they can pin down the few days that
Hmm.
they have a fertile time.
Right.
And if they want to get pregnant, they'll make love during those days. If they don't want to get pregnant, they'll avoid those days.
Right.
And
I know a couple people that track it fully just by taking their temperature. Like every
yeah,
morning they take their temperature and it somehow they're able to track it.
yeah, they should
Which
watch.
I couldn't do that because I'm
Right,
not consistent enough on
right.
anything.
But they should watch their cervical mucus as well. Like,
They probably
um,
do.
the cervical mucus is a really big,
Wow.
indicator of fertility.
Maybe that'll be another podcast we could get into
All
all the
right.
different
Yes.
birth control options and stuff that are out
Yeah.
there. Yeah.
Right.
Super, super cool. Awesome.
Yeah. So maybe we should leave it at that for now, huh? Because I have to
Yeah.
get to work.
Yeah, you have to get to work. I have to get to work. We're busy. And thank you guys for listening. I know it was nearly, too long since our last episode, but we are working on it. I'm moving, so my background's going to be changing, and she's hard to get it on an appointment because she's got so many different things going on with work and
But I
yoga.
love doing this with you,
Yeah.
Bridget. It's
Me too. Yeah.
it's like we're like learning about each other as well, right?
We have to like make ourselves do this officially in order to to share some things. Is that normal? I don't know.
No.
No. Well, we're not perfect.
No.
So thank you guys for listening. Please don't forget to like and subscribe. It means the world to us. And we'll see you in the next episode.
And next episode, I'm going to tell you the bloodiest story I have.
Oh, no.
I'm going to tell you my whole bleeding truth. Thanks a million.
Thanks a million.